I'm Dr. Willeford. I'd like to share my experiences as a physician to show how nutrition can be used in all aspects of medical care. I'm an anesthesiologist and interventional pain management specialist. I treat patients with fluoroscopic, X-ray guided injections of steroids into the spine for patients that mainly have back and leg pain or neck and arm pain. There's lots of reasons you can have back pain, but when it's associated with leg pain, it's usually neurologic, and the same is true with the neck and the arm pain. The nerve pain is from a combination of both structural narrowing and also inflammation. Most people haven't done anything recently to change the structure of their spine, but a combination of their activities has developed an episode of inflammation, and now the presence of the previous narrowing and the new inflammation causes the pain. We can get rid of the inflammation with the injections of steroids, and they'll be better for as long as or until they get another episode of inflammation. They can tolerate that amount of narrowing and not have any pain as long as they're not inflamed. Some people are great for 10 years after these procedures, and others seem to come back every few months with a recurrence. They all get the same advice for prevention. They know not to do the heavy lifting and the bending and the twisting that causes recurrence, but there's more to prevention than just the activity restriction. Some people are just more susceptible to having inflammation, and this is based on their own body's biochemistry. Our bodies are able to heal themselves and resolve the inflammation if they have the nutrients to support these chemical pathways. These processes are complex cascades of chemical reactions and simultaneous intracellular events that all need to work together to maintain your health. If you go to the health food store, you don't know what to take, and there's no way to measure if it's working. They often promote a single supplement or an herb for a symptom, but these processes are far too complex for this to be effective because there's a multitude of nutrients that are all needed at the same time in the right combinations in order for these processes to work. So how do you know what you need? Everybody has their own specific genetic susceptibility for certain diseases. We're all individual and unique. Until recently, there was no way to tell people what to take for their own specific nutritional support. Now there's a company that can analyze your DNA to make this assessment. We no longer need to guess, we can assess. I'm an independent affiliate for GeneWise Life Sciences, and this is how they do the test. You take a cotton swab and swab your cheek, and you mail the cells into the lab, just like on the crime shows on TV. Then they can analyze your DNA, not for the genes that cause cancer or anything like that. These are the portions of DNA that code for the biochemical pathways that cause disease. The one for inflammation is called tumor necrosis factor alpha. They all have these scientific names, but they can measure all kinds of things like your ability or need for antioxidants or detoxification, cardiovascular health, vision and bone health, or cholesterol metabolism. These are the types of processes, the processes that lead to disease when they don't work right. Now, this is evidence-based medicine. There's scientific evidence in the published medical journals that these genetically determined biochemical deficiencies can be mitigated or improved with the addition of supplements. Now, everyone's going to need something different depending on their tests, so they have hundreds of thousands of different combinations of these vitamins, minerals, herbs, and plant extracts, and they customize your supplements based on your test results. The scientists who came up with this are brilliant molecular geneticists, so you get exactly what you need and the combinations that are needed to support these biochemical pathways. These are the pathways that lead to disease when they don't work right, and they can't work right without the addition of supplements. I now include nutritional prevention advice for my patients. GeneWise is the highest level of nutritional prevention that's currently available to treat the underlying cause of disease. There's no way you can be healthy without eating massive quantities of raw organic fruits and vegetables all day, every day, and we know nobody does this, so you have to take supplements. GeneWise has the best supplements. It's the only company that has individualized, customized support based on DNA testing to meet your specific nutritional needs.